It is. We're doing it here in Santa Clarita because I guess we found that we know now that it's one of the highest fentanyl areas that there are, and I'm going to let the sheriff do the numbers, but I am going to say this is not a sheriff. This is not a Santa Clarita deal. This is a national crisis that we have right now that's plaguing our country and plaguing our kids and killing them. And if we don't do something about it, more and more people are going to die. What would you all do if you woke up in the morning and turned on the television and find out that a dozen people are getting killed on the streets every day? Isn't this the same thing? What's different? So we got to make some noise because we're not going to buy our way out of this. We're not going to arrest our way out of this. The only thing we can do is we can educate our way out of this, and we can make treatment available, and we can do something. I've been treating people for 40 years, and I'll tell you what, I know how to get people sober. This is a game changer. Fentanyl is a game changer. I know one thing that when I'm dealing with people that need to come into treatment, what scares them the most, I can't give them detox meds for 2 days. Because if I do, they're going to get even sicker. So I'm hearing from people, I'd rather be dead than have to go through those withdrawals. I'm going to take a minute to, Alyssa's here, and she's got how many days sober now? 41 days, and she came in. And a special, I'm really, really proud of you because you're pregnant. And you went through some serious detoxes, and you hung, and you cried, and you did it, but now you got 40-something days sober.
5 months.
Isn't that cool?
Good job.
Yeah, very good job.
I didn't know I was that far along pregnant. I was like, oh no, this thing didn't die yet. From that, everybody's dying from fentanyl, and the baby didn't die.
Well, thank God that
Congratulations.
thank God that you're here and that your baby's safe and that you're detoxed.
Thank you, Carrie, for saving my life.
No, you did it. But I'll tell you that the only way we're going to do this is by doing things like this. We got to be loud. We got to make some noise. People got to know this. Everyone out there is no good drugs out there anymore. If you don't get the drugs from the pharmacy and see it coming from a pharmacist, it's fentanyl. If you're using drugs, and I want everyone out there using drugs to hear this, it's Russian roulette, man, with 2 bullets. 2 bullets. And I'm hearing this from everybody that I deal with. Almost everyone I deal with that comes into treatment today says the same thing. I've been Narcan 3 times. Everyone I know are dying. People are dying all over. My friends, I'm losing them. I'm scared every time I use, but they continue to do it. It's one of the most scary. Like I said, I've been treating people for 40 years, and I've seen every kind of trend. I called the opiate explosion before it came. But this fentanyl, it just came in. It's taken all of us it's a game changer. Like I said, it's a different game now. So on that note, I want to thank everyone for being here in advance. Special thanks to KHTS for helping put this thing on, and for all our speakers, and for Austin, Dave, and everybody else. And I want to introduce Congressman Mike.
I appreciate it. Thank you. Appreciate you guys. Thank you. I want to first of all thank the Action Drug and Rehab facility for hosting this event. I also want to thank the media for covering this. Think of this as an old school public service announcement on steroids. Okay, this is our opportunity as elected officials, as law enforcement, as city council members, and as parents to put a bright, shiny light on this problem that we hear talked about a lot, but I don't think anyone really understands it. I don't think anyone really understands the magnitude of the problem, and I don't believe they understand the severity of the problem. And so the goal of today is literally to save someone's life. And if we all do our jobs correctly in the wake of this, it's to save hundreds of kids' lives. And I use that term kids. It's not just affecting kids, it's affecting adults. But it's really hitting home to our nation's youth right now, and especially here in Santa Clarita. I represent the 25th Congressional District, which is Santa Clarita, the Antelope Valley, Simi Valley, Porter Ranch. And here in Santa Clarita Valley, we're seeing a trend that's very dangerous that Sheriff Villanueva will talk about. But just this year alone, we've had 21 folks succumb to this poisoning. These are deaths and the poisoning of our kids. There's a very important nuance here, and it's very important to recognize that these aren't overdoses. These aren't pills that the kids are thinking that they're taking. They're doing something that is usually online through special apps and very readily available apps where they can order Xanax, Adderall, whatever they think they're ordering, but they're not prescription drugs. They are actually just fentanyl. They're not laced with fentanyl. They are made with fentanyl. And this is very important. I've met with several of the families who have lost their kids, their 13-year-old daughter, their 16-year-old daughter in my office. And as a father, I'm especially, frankly, scared of this problem, because this is something that, as a parent, you feel powerless to, because we're not with them all day long. They're in their phones more than they are not in their phones right now, and it's hard to control what they're seeing and hard to control what they're doing. But as a father of a 15-year-old, it scares me to death that my son can go online, potentially order something, have it delivered to his house, and have it be something that is literally meant to kill us. And so this is avoidable. This is something that if parents take the time to educate their kids on what's going on out there, to ask the tough questions, to have those tough conversations, we can prevent this. And if we just focus on making sure that our kids and the younger generations understand this problem, and that it's resident literally in every pill. It's like the metaphor that I was taught a couple years ago about this problem is it's like a batch of cookie dough. And as much as you mix it up, there's always that clump at the bottom of cookie dough that doesn't get mixed all the way. And it's the same thing when they're building these pills with fentanyl. They think they're doing it correctly, but there's always that one residue at the bottom of the batch that is overdosing effectively from what they're supposed to do or what they're trying to do. And it ends up becoming very poisonous and very lethal. And that's why we see these deaths. And so parents need to pay attention. We also need the county to prosecute this. I've been pushing at the federal level for, I'm a co-sponsor of a bill that's called Halt. It's an acronym which stands for Halt All Legal Trafficking. And it's specifically tailored to fentanyl, to have it scheduled as a Schedule 1 illegal narcotic. And because right now it's not, and it's very dangerous. It's unbelievable that it's not already. And so at the federal level, we need to make sure that we treat this drug accordingly. This is a very lethal drug. Hopefully what you've been seeing out of me as well is pushing this White House and this administration to secure our border. I've been to the border. I've seen firsthand the damaging effects that it has, not only on the folks coming across, a very inhumane atmosphere as they cross this border, especially in these summer months, but they're bringing with them, in many cases, some bad actors bringing thousands of pounds of this fentanyl, enough to kill every human being in the United States a couple of times over. So this is a federal problem. This is something that we've got to make sure that we're fighting at all levels, from the House to the White House. But there right now are kids, dying of this stuff. There's parents walking into their kids' bedrooms every morning, seeing their teenager dead, and they had no idea that what they were ingesting was actually a poisonous, very lethal drug called fentanyl. The last thing I'll end with is this is why we don't defund the police, okay? This is why we don't kowtow to this very far left progressive mindset that if we just take money out of the hands of law enforcement and place it other ways, that we will avoid our problems. This is vastly impacting our local law enforcement agencies. The amount of the volume that they're getting now in helping folks recover from this is beyond a scale that they can keep up with right now. And the last thing they need is to be defunded. They need to be able to hire. They need to be able to go get the resources. We've been fighting at a federal level from my office to get these federal grants to the LA Sheriff's Department to help them get whole. But in the wake of this defund the police movement, in the wake of our kids being home and isolated during this COVID lockdown period, we're effectively in the worst case perfect storm for kids to be killed by this very dangerous poison. So we have to pay attention. Parents, please have those conversations with your kids. They're not easy conversations. If you have neighbors or grandkids, please do that. 21 people in Santa Clarita Valley have died from this poison just this calendar year. We would not tolerate that. If that was a madman with a weapon going around killing people, they'd be behind bars. We should be treating these drug dealers the same way when it comes to fentanyl, and we can't accept this any longer. By the way, that's 50% higher than most parts of LA County, okay? So this is a very unique, a very difficult problem for us here in Santa Clarita Valley. So with that, I'll turn it over. But I appreciate you guys taking the time. I appreciate the media for covering this. For some, National Fentanyl Awareness Day is yesterday. But unfortunately, for literally hundreds of thousands of parents, that awareness came one morning when they walked in and saw their dead teenager. And we've got to stop this right now and prevent it from happening in the future. So thank you, sir.
Thank you, Mark Castillo. Also, just one more quick thing before we give it to the sheriff. It's not just in pills. It's in everything right now. It's in crystal meth. It's in cocaine. It's in pills that look like Xanax. It's whatever. We're even testing adolescents right now, guys that are smoking marijuana, and it's showing up there too. So it's just one of those kind of things. The message I don't want to get out there is fentanyl is bad. All drugs are bad. All drugs starts innocently and can end very tragically today. Let's give it to the sheriff.
All right. Well, thank you. Over the last year, the LA County Sheriff's Department custody support services and custody operations have seen an increase in inmates overdosing within the jails, specifically related to fentanyl. These narcotics are smuggled into the jails by incoming inmates or a criminal element within the public seeking to profit from the vulnerable inmates already affected by drug addiction. And remember the size of fentanyl. And heck, we've had people attempting to smuggle in bigger things, marijuana, cigarettes, cocaine, heroin, and this is a fraction of the size, which makes it that much easier to introduce into our custody environment. Illicit narcotics within the jail system are worth 10 times more than narcotics sold on the streets, generating large profits for those willing to risk smuggling narcotics into custody. In fact, in our custody environment, we've introduced, obviously the Narcan, deputies have been having it for years since it first came on board, but now we've had Narcan available within the modules themselves, so the inmates are administering Narcan to each other, and they've saved dozens and dozens of lives between the deputies and the inmates, and that just gives you an idea of the level of prevalence within the system. So this is, like you said, this is a perfect storm and a perfect drug to do the most amount of damage in the least amount of time possible. That's very scary.
Sheriff, I know people that have 6 and 10-year-old children learning how to Narcan just in case their older brothers die or sisters.
Wow,
Yeah.
that's sad commentary. Across the nation, fentanyl overdoses and deaths have reached crisis levels. In fact, in the year 2021, for the first time in our nation's history, we surpassed the 100,000 mark of drug overdose deaths in the United States, and that is a somber milestone to reach. Because of the potency and low cost of fentanyl, those manufacturing the illegal narcotics often mix fentanyl, as you said, with more common narcotics such as heroin and methamphetamine, increasing the likelihood of fatal interactions. You know, imagine, you ever recalls the death of John Belushi's Speedball, mixture of cocaine and heroin. You have a suppressant and you have the opposite effect. You have both things going, but the stimulant one lasts a short period of time, while the suppressant lasts a far longer time. So ultimately, you end up succumbing to the suppressant. It depresses his ability to pump oxygen, breathing, and all that stuff, which led to his death. Now with fentanyl, 10 times stronger, the mixture. So that really is doing a number here. The LA County Sheriff's Department school resource deputies and community relations deputies share information regarding the hazards associated with illicit drugs with teens, community watch groups, and others through a variety of forums that we're using. And this is school functions, neighborhood watch meetings, community academies, and so forth. So here's the statistics that you should bear note. Our overdose response task force was started on July 1st of 2022. Overdose deaths in the county of LA for the past 3 years are as following. Follow these numbers. 2018, 1,204. All right, that's about 3 a day or more. 2019, it jumped to 1,652. 2020 jumped to 2,425. 2021, we don't have complete data, but we almost got that number by the third quarter of 2021. That just tells you that the number is just accelerating upwards. By our count in patrol areas serviced by Santa Clarita Valley, there have been, as the congressman said, 21 overdose deaths in 2022 this year so far. That is scary. And the only thing we will put out regarding the investigation is that fact investigators will be assigned to the case. We will not be disclosing what we're doing to secure convictions. And the Overdose Response Task Force goal is to investigate and identify the sellers of the controlled substances and determine if they are criminally culpable in the death. And here they have to signal out, I think the villain of the month right here, actually villain of the decade, I think. It's going to be Senator Bradford, who he personally torpedoed Senate Bill 350, which would allow us to criminally prosecute drug dealers for manslaughter when their product causes the death of a person. And I'm quoting him. He said he didn't want to expose drug dealers to more incarceration. Yes, that is Senator Bradford, who allegedly represents his community. That is what we're fighting right there. Now, actually, you know what? I'm going to have you go through these for Santa Clarita. Okay. Specifically, and then I'll have you go through the notable arrests and the things you guys have done. That's his too? Okay. So we're actively at work. Our Narcotics Bureau is working hand in hand with our patrol stations, and the task force is working diligently with homicide. In fact, if maybe you can explain a little bit more how the task force works, I think that would help. But we have a huge problem on our hands, and we don't want to use incarceration as a way. However, when it comes to targeting those who are actually actively trying to sell a product that is killing people, yes, incarceration is appropriate. I don't care who you are, where you come from. If you're doing something that's causing someone else's death, you should pay the price for that. And that's how we can put an end to this tragedy right here. And of course, we have to go with the education component and everything else, the intervention. But we have to be doing all those things at once. We can't just, cover our eyes and pretend that, we don't see it. But with that, let me turn it over to Captain Dean from our Narcotics Bureau. Sure.
Thank you. So, like the sheriff said, I'm the captain of LA County Sheriff's Department Narcotics Bureau. So, at Narcotics Bureau, we kind of take a three-prong approach to dealing with narcotics. Obviously, there's education and prevention, which is getting out to these schools, elementary schools, high schools, colleges even, getting that prevention message out there. And then, obviously, the rehabilitation aspect and getting that. And then there's the enforcement aspect. So, without getting too much into what we normally do, Narcotics Bureau has always been pretty aggressive in going after narcotics dealers. But specifically speaking about what the sheriff was just speaking to, on July 1st of this year, we started a specific team to deal with nothing but overdose death investigations. The sheriff's department has always done something with these investigations, but it fell on the normal narcotics dealer to do, and that's a lot for them to do, to have to go out there and look for not only these large dealers selling 10,000 fentanyl pills, hundreds of pounds of meth, and then dealing with a death investigation. So what we did is we decided to take that off them. We created a specific team of investigators that are highly trained. They've all been to our homicide investigation school through the department, and we're actually treating these now as death investigations. The task force is made up of members from our Narcotics Bureau, Operation Safe Street Bureau, which is our gang investigators, major crimes, special victims, fraud and cyber crimes, and working in conjunction with our Homicide Bureau. Like the sheriff said, the goal of these investigations is we are sending investigators out the night somebody dies, unfortunately, from an overdose, talking to family members, witnesses, and trying to identify the person that sold the controlled substance to that individual. And we are treating these not as a narcotics investigation, but as a death investigation. The ultimate goal is to present these cases and secure convictions on those individuals, whether that be on the federal side, which we have been working in cooperation with our partners at the Drug Enforcement Agency, as well as the United States Attorney's Office, or we're hoping that we can get some cooperation on the state side as well. We're treating these again as a death and pursuing them as such. So with that, I'll turn it over to Justin.
Perfect. Thank you, Captain Dean. Appreciate it. Thank you, Sheriff. Carrie, thank you for having us here and organizing this. Very important, not only in our community in Santa Clarita, but throughout LA County. So thank you for that. Yeah, and just to touch upon what the sheriff was saying, 8 short months of 2022, 21 overdose deaths in Santa Clarita. Obviously, that's 21 too many. It's terrible because there's young adults, young kids are being affected by this, and it's touched so many families out here. Just some other approximate stats or some quick stats. We've had about 150 calls for service in the last 8 months regarding overdoses. which is amazing just to think in 8 short months. Another 700 people were arrested for narcotics-related offenses in the last 8 months. And station deputies at Santa Clarita Station and Patrol have used Narcan over a dozen times to save lives just in the past year or so. So you can imagine if those deputies weren't equipped with Narcan, what may have happened. So to take a step back, all of our patrol deputies are trained and equipped with Narcan. It's oftentimes that they get to a call for service faster than the fire department, not always, but oftentimes do, and are administering that Narcan quite a bit. Certainly if they get there first, the fire department will follow up with another dose, and of course, Henry Mayo Hospital will continue that. Really what we're here today, and I know Congressman Garcia kind of mentioned it, we're really calling upon everybody, that's families, that's friends, parents, neighbors, to help your loved ones get the help they need. We are very, very, very fortunate in Santa Clarita. We've got an abundance, almost an endless supply of low-cost or no-cost resources for not only drug, but alcohol, mental health, you name it, we've got it out here. Certainly Santa Clarita Sheriff's Station, we want to help in any way we can. One thing that I would like to highlight is our juvenile intervention team, often called our J team, commonly known as our J team. We established it back in 2010 as we saw that the opioid crisis was coming, and that's been the team's main focus. They work in direct partnership with Captain Dean's squad over at Narcotics Bureau, also with our school resource deputies. As you know, we have school resource deputies in the William S. Hart School District, in our high schools and junior highs. And ultimately what their job is to aggressively enforce narcotics laws, intervention and education at a young age, so that's junior highs and high schools, of course. And then as part of our juvenile intervention team, I'd like to highlight our intervention specialist, Robbie Robinson, if you could raise your hand over there. So I know many people in this room know Robbie. Robbie is a former probation officer for LA County, retired, and he is now a civilian intervention specialist with our J team. And ultimately, Robbie's job is to bring resources to anybody that needs them, anybody that's arrested for drugs or any sort of narcotics-related offenses. Robbie doesn't stop there. He'll certainly get you the help you need with any drugs, alcohol, mental health, you name it. So Robbie, thank you for that. We really appreciate that. And of course, the J team, our goal is to intervene as early as possible. And by going into the schools and with resources like Robbie. So if you're in need of any resources and you want to connect with Robbie Robinson, please call the station and ask. He's available 24/7. If he's not there at the time, we'll get a hold of him. Of course, we'll put some more information about Robbie on our social media. Just a couple other quick resources. BeTheDifferenceSCV.org is a one-stop shop that you can go to and find any resources in Santa Clarita. Also our station social media. So we're constantly doing public service announcements, also our available resources, and we'll throw, Robbie will throw your contact information up there again the next couple days. Also our Parent Resource Symposium, our yearly Parent Resource Symposium, I should say, that's Friday, September 23rd. It'll be at 6 p.m. at City Hall. This year it's titled Chasing the High. So this year it's about drugs, and we'll have a lot of panel specialists on there to answer all your questions. That's 6 p.m. at City Hall on Friday, September 23rd. It's also going to be live streamed like we did last year as well. And I think really the last thing, as evident by why we're here today, we all know that SCV is known for grassroots causes and grassroots efforts. And really, I think that's based on community engagement, which we're doing today. Public safety, which of course we have here, and then of course leadership from our elected officials, which we have here today. And hopefully things like what we're doing today is just going to raise awareness, garner more resources, and ultimately save lives. So thank you very much.
And our mayor, Lorraine West.
Thank you. In advance, speaking, I'd just like to say thank you, Carrie, for being on the front line every day for years and years and years. We appreciate it.
Thank you,
greatly in
Lorraine.
Santa Clarita. I'm Mayor Lorraine West, City of Santa Clarita. I'm joined today by Councilmember Bill Miranda and Marcia McLean. There is a crisis that's happening in America, and it's now hitting Santa Clarita, and it's right now. The deadly man-made drug called fentanyl is making its way into all kinds of counterfeit pills, if you've heard. Fentanyl is poison. This drug is up to 100 times stronger than morphine. It was brought in by cartels. They hide it in other drugs. and the social media and smartphones are the superhighway to access it. There are all kinds of treatments for all kinds of addictions, as you can find out here. But with fentanyl, you don't know it is there until it is too late. There is no time. You may just die. A few grains of fentanyl will make you high. A couple more will kill you. Fentanyl is the most powerful opioid ever created by man. Fentanyl fatalities have skyrocketed nationwide. It has hit the Midwest extremely hard. The DEA estimates that 25% of all street drugs are laced with fentanyl. It's here in Santa Clarita, and I have seen the catastrophic effects on our community and families and children that I love. Children with amazing potential who are now gone. Parents who are left in shock, pain, and only a memory of what their child would have been. This is a war to fight for the lives of those we love and those we care about. This is the deadliest drug threat that has ever hit our nation. And we have to talk about it. And we have to talk about it loudly. We have to take action, and this is why we are here today. This is a catastrophic situation in many states, and we don't want it here in Santa Clarita. It takes very little to die. Stop it here. Stop it now. I want to thank you, every one of you, for being here. I know the city is going to do everything we can to work with Action, our law enforcement bureau, our sheriff, thank you, Sheriff, our congressman. As a council, we are 100% there to help our families and prevent this from killing any more of our youth.
And I will say, again, I just want to repeat myself again, this is not just a Santa Clarita problem. This is a nationwide epidemic, pandemic. It's destroying our kids. In Santa Clarita, we're fortunate enough to have a city that wants to talk about it, and a congressman that wants to do something about it, and a sheriff that wants to be there and help. So I applaud Santa Clarita for what we're doing here today. Joe Messina's with the school board.
I'm the current president of the school board. Yeah.
Excuse me, Joe.
That $1.75 gets you a cup of coffee, but I'm gonna go back a little bit in time. I've known Carrie for about 18 years now, and when I first got on the school board and I saw some of the issues that were happening with parents and kids, I was amazed or surprised at the attitude of some of the parents. And in my nighttime job, I do a segment called "It's Not Your Grandfather's Dope," and the reason I named it that was because Mr. Quashinier had taught me how much the change has been in marijuana from the 70s, 80s, 90s. And not that any drug is good, but the ignorance and the misinformation that parents and people around have is partly what's killing our kids, because they don't know and they don't get it. They don't really understand. And as time has gone on, we now are together 2 or 3 times a month in my job, and we talk about the drugs and the issues going down and what's going on with fentanyl, what have you, and the fact that you can order drugs online easily, just like you order a new coffee maker or what have you. I was also surprised to learn that you can buy a pill making machine on Amazon.
You can buy a press machine, yes, and make your own pills.
That's
Exactly.
right.
And you know what? That's that rumor that you can tell them apart is a rumor. You cannot tell pills apart, fake pills from real pills at all anymore.
So as we see things happening on the school board campuses, he's always the first call that I make. And I can't tell you how many countless of lives that he's probably saved because he answers the phone anytime, day or night, with these parents who will call and say, I don't know what to do. So-and-so, my son or daughter is doing this. I don't know what they're into. And he's always there to help out. The other reason that we have such safety on our school campuses is not just our SROs, but the Sheriff's Department as a whole that backs us up. We get great support from Captain Diaz and the Sheriff's Department. And if we didn't have them, I can only imagine what our campuses would be like, because they're out front. They're on top of this. The Halt School District has many programs to reach out to those kids and students that might be in trouble, that you can see are in trouble. We don't wait for it to happen. We reach out ahead of time and make sure they have these support programs that they need to succeed. And I won't say stay away from it, but at least get the help that they need to stop doing what they're doing. So you heard earlier, and it's the truth, it is truly a community effort around here between the city council, the sheriff's department, the school board, and Carrie's organization here. It's what makes us successful. And no death no death is acceptable, but I could only imagine if we weren't all working together, where we would be today. So I want to thank you for coming also and helping us get the message out.
Thank you, Joe. You know, just a little challenge, not just for you, but for every school district in the country. I really believe that we need to have Narcan, sadly, in every nurse's station, because you just never know. It's that one little pill, and it just that drive from wherever the deputy is to the school that we might lose that kid. So I would hope that every school district in this country now has Narcan in the nurse's office. Isn't that sad? But that's where we're at today. But I'd rather see us to be proactive than to lose more children. Anyways. Real quickly, I know we're pushing for time, but I know Jaime wanted to say something, and Jaime's a friend of mine. And Jaime is one of the parents that walked into his, I'll let him tell you.
It's good seeing you again, sir. How are you?
Good.
Yes, thank you. Appreciate it. Good afternoon, everybody. My name is Jaime Puerta. I am the president of VOID, Victims of Illicit Drugs. I got in this fight very first day when I found my son dead on April the 1st of 2020 due to fentanyl poisoning. My son went onto Snapchat, ordered what he thought was a blue M30 oxycodone pill at the very height of the pandemic, and it wasn't what he thought it was. It was a cloned pill. It was a pill made of fentanyl and binder, and it killed them. And that's exactly what's happening to our children here in Santa Clarita. They don't have the information. Law enforcement is doing the best that they can. I know Rep. Garcia also is doing the best. I've met with him. He's had our ear. Sheriff Villanueva, I've already met with him 2 or 3 times. Lieutenant Fuchs, Captain Dean, I've already met with them downtown. They're doing the best that they can. But there's a disconnect. There's a disconnect because the information is not getting into our high schools. The children don't know. They don't have this information. And when they go onto social media platforms like Snapchat or Instagram or WhatsApp or Signal and buy what they think is a pharmaceutical grade pill, then if you're the unlucky parent, 3 out of 4 parents who, sorry. As you can tell, I'm very passionate about this. 3 out of 4 parents, is the statistics nationwide, is 3 out of 4 parents who find their children who pass away due to fentanyl poisoning are found in the early morning hours in their safest place in the world, which is in their bedrooms. Like I found my son Daniel, who is with me every day. All I want to do is try to save lives. And the only way we can do that is with education. Of course, I want to arrest our way out of this. Believe me, I'm with you on that. DA Gascon, you need to get on board, sir, because these are not overdoses. These are poisonings. Of course, there are some overdoses too, because fentanyl has this ingredient that if they don't die, they become immediately addicted to it. Our children are being deceived to death. And that's what's happening. And as a nation, we have to do something about this. I co-founded a National Fentanyl Awareness and Prevention Day yesterday, along with Andrea Thomas of Colorado, who's the president of Voices for Awareness. We had over 100 events around the nation just yesterday alone. The Drug Enforcement Administration backed our day. CDC did as well. We have a lot of support, but we need support to getting into the schools, sir. I'm traveling around the country with our documentary called Dead on Arrival that is being used to raise education and awareness in our schools. I've been in Wichita, New Jersey, Philadelphia. I've been very busy, sir, since I last met you, by the way. Just so you know.
That's good.
You told me to go, and I did.
Yeah.
And so did Mr. Villanueva. So I've been traveling around the country, and I couldn't do it without this man right here, Kerry Quashin. And another gentleman who I have to thank as well is Austin Dave, who shortly after my son died, saw my passion that I wanted to do something about this. Parents, if you think that this can't happen to you, you are sorely, sorely mistaken. You don't need to have a recreational drug user in your family or somebody who's addicted to drugs to pass away due to this scourge. 77% of all children between the ages of 11 and 17 years of age in the United States who die due to drug deaths are all fentanyl related. 77%. Do not forget that number. Thank you so much. Good seeing you, Gum. You're very welcome. Yeah, I'll back you up on that, Bill. If you need me,
We will, yeah, we'll reach
I
out.
need to talk to Captain McMorris.
And also, I want to take one more minute for Crystal. Now, you don't have to talk, but I just want to say, Crystal's a friend of mine. And this is what it's like. Crystal went into her child's room 3 times one night to see if he was okay, and the 4th time he wasn't. So we got to do something. We got to make some noise. We got to get loud. We got to educate. We got to arrest. We got to do everything because enough's enough, man. It's got to stop, or it's going to take our generation of children away. So I guess now we'll hold it up for questions. Gentleman right there.
Borders have been open, and this garbage is coming in across the border. We need the federal government to step up and provide funding to families to help them get their family members through counseling and through kicking this habit.
Yeah.
And this nonsense that we're attacking AR-15s as being the aggressive issue, that's a lightweight compared to what we were facing. This is just beginning. Trust me, this is beginning. I lost my nephew 7 years ago. Guess what? That was a first-time heroin use. Wasn't heroin.
Right.
Okay?
Yeah.
You know, they talk about heroin being cut 100 times. They can cut 1,000 times at a drop of fentanyl. It's 10 times more potent. And the addictive value is like that.
That's right.
We need the federal government, we need a bill sponsored
Yep.
and get it done
Well,
and push it.
I appreciate that comment. I agree 100%. I think there's things that we're doing from a funding perspective to help local communities from a federal government perspective, and I know states and counties are doing the same. But we had roughly $4.2 billion in our Health and Human Services bill this last a couple months ago. Then the omnibus that I supported that went to the opioid as well as fentanyl writ large crisis. 1.5 billion. For grants that go to the state for opioid response at the state level from the federal government. So the money is there. There's a lot of money going to this problem, and it's mitigating the effects of this, and it's hopefully getting resources onto some campuses, but it's not keeping up with the pace at which the drug dealers are scaling up. Okay. And so the real problem we have right now is that this substance is coming across our southern border completely unfettered and unchecked. They are, in fact, being incentivized to come across the border in some cases to get this into the United States. This stuff, primarily, the primary ingredients of fentanyl, the stuff, the building blocks of fentanyl are produced primarily in China and then sent to Mexico for processing. Okay, there's a reason it's going to Mexico, and the United States is one of the largest consumers on the planet of this stuff. The reason it's going to Mexico is because they can do final production of fentanyl there, and then they know they have unlimited access to the market to the north in the United States without a federal government that's actually enforcing its own borders. And so while we spend these billions of dollars to save lives, we have to, I'm not opposed to that. The reality is that this problem is getting worse because we have a southern border that's completely wide open. And I've been leaning on this White House as much as we can to get him to realize that this isn't just an immigration problem. This isn't addressing immigration policy. This isn't good for the people coming across the border. And it's literally shipping the poison into the United States. It's no different than arsenic being brought into the country. And we wouldn't allow arsenic at the volume to come across to kill our entire population 2 or 3 times, to come across completely unchecked. But for some reason, this president of the United States, whose job it is to provide security to the country, is literally allowing this to happen because it was a campaign promise that he would open the border. And so this is the challenge we have right now. This is why we need to pay attention to our elected officials and who we allow to represent us in office. You have my assurances. I'm going to keep doing everything we can, and we're going to get all the resources from the federal government to the lower level. What scares me, though, is that it's impossible to keep up with the pace that the bad guys are scaling up to. And without the conversations in the House, I agree we need to have more conversations and the resources in the schools. But you know, if you as a parent or grandparent aren't talking to your child or grandchild about this problem, you don't know for sure. And even when you do, you don't know for sure. So it's imperative that we at the lowest levels, from the households, right, to the counties, to the state, to the federal government, to the White House, that we all recognize this killer and protect our kids. And that's, until that happens, this is a problem that's going to keep going. We will literally entertain any options to mitigate this and help, you know, at least minimize the effects or slow down the death count. But as long as this drug keeps getting imported at the rates that it is, it's going to go parabolic. The death rates will go parabolic as well. And that starts with, unfortunately, the President of the United States needs to do his job.
And just to quickly piggyback, I just want to say the average parent, this is what's really scary. The average parent spends between 2 to 10 minutes with a teenager today. Here's how it goes. How was your day? It was good. How was school? It was okay. Have any homework? I done it. Are you hungry? I ate. The last thing, no, really, the last thing a child does before he goes to sleep at 13, 14, 15 years old or younger is say goodnight to his friends in person right here on the phone. First thing they do when they wake up in the morning before they use the restroom is check their social media, say hi to their friends, and they go to school. And then they come home, and who's waiting for them? In most homes, their friends again. So if you want to know why we're having such an issue with children and drugs and bad decisions, it's because they're connected to their friends today, not their parents.
The entire kill chain for fentanyl is in your phone, right? So that's what's important. We can teach your kids to look left and right before they cross the street, to not talk to strangers, but literally everything that can kill them when it comes to fentanyl is sitting right here in this little device.
There's another number you need to be aware of that we kind of lose perspective because the numbers are so large. If you compare actual homicides by firearms or anything in comparison to fentanyl poisonings, it's about 12 to 1. 12 to 1, dozen times greater. And that's after having a 2-year increase of 94% in homicides in LA County, which is a historical number. Kind of mirrored the trends throughout the entire nation, but this is a dozen times greater. It's a silent killer. There needs to be an outcry.
I have a question. Would you say the overall purpose of this news conference is to raise awareness of the issue, or was it to announce the captain's program that he spoke about?
Twofold.
I would say it's to raise awareness. You know, I mean, obviously, like I said, narcotics it's a 3-prong approach, and prevention is huge. I mean, obviously, we can prevent the deaths and prevent our kids, you know, getting out there and preventing them from use it. Like Jaime said, getting to these schools and preventing it from ever happening is the best deterrent. And obviously, also the rehabilitation portion of this. I mean, they're running a great program here with success stories in the audience. You know, just that. The enforcement aspect is something that we're doing on the back end of it as well. And again, we're treating these as death investigations now. So it's kind of all three together.
When did that program kick off? When did that start?
So the LA County Sheriff's Department has always investigated overdose deaths, but we specifically created a task force and really put our teeth into it on July 1st, where we actually have a full-time unit now with a lieutenant, sergeant, 10 investigators. We're actually throwing a lot of resources at this, sending our investigators out there. They're highly trained. And again, we're not treating these as narcotics-related investigations anymore. We're treating them as death investigations.
One more question. I don't know if you answered this. Have you been able to submit anything to the DA, and have there been any prosecutions?
So we are currently working with the DA's office, and we have not secured any convictions yet through them. But again, we are in the early stages of presenting cases to them.
Do you know how many?
No, I won't get into those details.
Can I just say something that maybe they're not comfortable saying, but I am? They're doing this right in the midst of the highest crime spike that our area has seen probably in decades. They're doing this in the midst of being defunded. this defund the police wasn't just people, marching and protesting in the street. It literally happened in LA County. LAPD, LA County sheriffs were literally defunded. Now, some of that got given back over time, but the damage has been done. And we're seeing right now in the midst of this, go ahead.
We didn't get a dime.
We didn't get a dime back.
Not a dime.
The LA County,
let's
County,
clarify that.
that's right. LA County did not get a dime back.
Oops.
LA County sheriffs did not get a dime back. But they're also standing up this task force, not just in the midst of the crime spike, but also some of the worst retention problems that they have. We have officers and sheriffs retiring early because of this environment. The toughest recruiting period, and right now we have a board of supervisors that doesn't allow them to actually bring on new sheriffs right now. And so they're doing this despite the headwinds and some of the elected officials who aren't supporting them. And they can do so much better if they just had the support of the elected officials around them and all of the community to help them do their jobs on a daily basis. And we need to defend them, not defund them.
In fact, I can say that I want to thank the city of Santa Clarita, and this is a fine example. We have the city leadership, we have the school board leadership working in conjunction with our rehabilitative services, our congressional representative, the sheriff's department. This is an example of what everybody working together towards a common goal looks like. With the board of supervisors, it's the exact polar opposite. It's how can we defeat, defund, discredit the sheriff's department, and how can we remove all of their resources to the point now that it's impacting our basic emergency services to the community. That's the crisis level that defunding has gotten in LA County right now. The board of supervisors did not get the memo from the president.
Joe?
Yeah, Jaime, I want to address something you said about the schools. I'm in 100% agreement with you. I've been with Carrie to try to get some programs together and out in the public. We have 22,000 students in our district. All the districts together is 56,000 students. And I know this is going to sound distasteful too, but we're the parents. We put on a program, we bring them in, we do all this advertising, we get 20 parents show up. We have 22,000 students. If we could do as many advertisements on TV about fentanyl and drugs as they do about getting your COVID-19 booster, we probably could make a dent. But they won't do it. They won't spend the money, and I don't know why. These are our kids, and they won't take the time to do it the right way. And he's been a great advocate in helping us get the programs in. We can't get the parents to show up.
I'll do it for free.
I want to talk to you after this. I want to get with you. Let's do something. Let's make something happen.
Can you talk about fentanyl in marijuana? Is that something that's
You
happening?
know what? People are asking me that every day, and we are absolutely seeing it. I mean, we are getting adolescents that are coming into our treatment centers, and when we test them, and we know it's a marijuana deal, but they're showing traces of fentanyl in that too.
Is anybody, are we checking marijuana that's being sold in stores in LA County for fentanyl?
Here's what I know is I know that they're not always buying them from appropriate stores.
If
I'll
you
say that.
if you
How's
recall, we had all of the the sheriffs have seized in the last year, over a year now, and there's two large major operations they've done in the Antelope Valley now that was close to 1.8 billion in illegal marijuana grows in the Antelope Valley, right? So this is dark black market stuff. This isn't, at best it's gray market, but it's not being regulated. It's not good for the real clean commercial market. So these kids, the bottom line is these kids can get stuff from all sorts of venues, and it's through the phone, and it's not always coming out of a licensed cannabis provider.
How are they adding fentanyl to marijuana? How are they doing that? Do we know?
Well, you know, when it comes to here's a question for another question. Crystal meth is speed. It's an amphetamine. Why are they putting a downer in an upper? I mean, who knows why they're doing what they're doing, except for the stronger the drug is, the more people want to buy it. So it's all about money.
It's addictive.
And these dealers, and it's addicting, and these dealers, they don't, I'm telling you right now, they make money off of people's weaknesses. They don't care. They're putting what they can in so that you will, for that drug person to come back and get more drugs. And it's I wouldn't even call it an epidemic. I call this a pandemic right now that we have. And I'm gonna end my speech by saying this. Okay, we have 100 and something deaths from an accidental overdose, right? What about domestic violence? What about suicide? What about child molestation? What about domestic? I mean, what about robberies, car crashes? What's the real pandemic here? What is the real pandemic? There is no vaccine for this. This is what we need to do. We need to have more meetings like this. We need to get loud. We need to let people know what's going on. We need to talk to our children. We need to educate our educators.
Yeah.
This is what's going to work. We need to arrest and put people in jail and have DAs that allow people to go to jail. That's what we need.
Yeah.
I tell you, I have to say this, turns my stomach. Captain Diaz, you guys are doing such a great job. And I look at the arrests and I see arrested and released. I'm sorry, guys, but if people do what they can get away with, and if they can keep getting away with it, they're going to keep doing it.
I think a lot of people sometimes don't do anything about something unless it's impacted them directly. So for those parents who maybe, not my kids. My kid wouldn't do this. My kids, they're out with their friends, they're out doing this. Or even those elected officials maybe not in the room who no one that they know has died, so maybe they're not taking it as seriously. It's almost as if you're saying, well, we need to regulate how tall grass is on a baseball field. Well, I don't play baseball, so I don't care. For those who don't know, or don't know someone who's been impacted by this, or maybe don't have any idea of what this is, or maybe you're hearing about this for the first time today, what words of a warning would you have for those people who don't know someone who's impacted by this, but may?
I can give you a real simple one. My next door neighbor died of fentanyl poison. He was one of the very first cases that the task force is investigating now. That's how close it is. If we did a dot map on all the fentanyl poisonings, you could look at your house. In fact, we should generate that map, just so you get an idea how close it is to your house. And then it's not for whom the bell tolls, it tolls for thee.
And I will say that here's another statistic for you. 1 out of every 6 Americans will have an alcohol or a drug problem in their lifetime. That doesn't mean they'll get treatment, but 1 out of every 6. Yeah. Robbie.
I just wanted to say I support everything that all of you are doing. Captain Diaz and I go way back. I have a good sergeant that I work for. He's very understanding. But one of the bottom lines, the parents, a lot of them are in denial. And I'm not talking about the river in Egypt. A lot of them in denial. Your son is using drugs. No, he just smokes marijuana. Well, ma'am, your son is using fentanyl. A good case, Deputy Rooney and I were out in Val Verde, and I brought it to captains. We had some kids that attempted suicide, and I was going out there with Deputy Rooney and talking to the kids. The parents were helpful. There was another case of a kid. He had a little fentanyl. He was taking chairs, throwing it through windows because he claims he was smoking marijuana. It was a hallucinant, whatever. So he started throwing it through the windows. I kept on. So I went to the DA. Says, you got to do something. And he kind of got an attitude. I said, if you don't do something here right now, something major's going to happen. He started beating on his parents, then they put him in jail. So I told the parents, I went to the parents and I said, write everything down and I want you to speak to the judge. When they spoke to the judge, the guy got 9 months. So we just got to keep fighting.
Crystal.
I'm listening, I heard what you said, and parents are not in denial, I think kids are self-medicating. The COVID numbers and the overdoses numbers are similar, very similar. I'm frustrated because my son died in August of 2021, and I don't know if you said when the drug thing with you guys, the task force, when did that start?
July 1st.
July 1st. So, if there's been 21 deaths because of fentanyl in Santa Clarita, how come nobody's knocked on my door? And also, oh my God, my son died, and before that, he was in the hospital 9 times that I can count. I just want to know, he was able to leave and walk out on foot. Where did you guys come in? Because it said that police were notified, he was gonna be put in 5150. And where did the kids go? My kid would come back home, but nobody came to my door. So I just, I think that he didn't even get cited, he just didn't even, I'm surprised I don't know any of you guys. None of y'all came to my house, sorry, but I wish that I could have had somebody come to my door because everybody turned their back on my son. And it's because nobody knows. Nobody knows how to fix this at all. I would like if anybody could tell me if some of this could get fixed, but nobody came to my door. Every time they released him, it wasn't 5150. It was he walked out or he ran out. And the police were notified and
Crystal, that's, you know, I love and care a lot about you, and that's why we're doing these things today, what we're doing.
well, and I'm learning too about this new course, and I just wanted to put you on the deal with me because I can tell you a lot of stuff.
We'll talk offline afterwards.
Yes. For sake of time, I know everybody's, got to get back to business and do the things. I want to really special thanks to the panel and everybody for coming. Thank you.